believe 210,000 people have died in America because of coronavirus?
210,000 people have died, but I don't know that 210,000 were as a result of the coronavirus.
You think what do you think the error rate might not be on that? Do you think half of that number is not related to coronavirus?
I think from what I've seen in the media and what they've said with the reporting process, that if you actually looked at those, as an example, they had people that were in hospice that had days to live, and then they died from what they had, and they got labeled as a corona.
Okay.
So,
like how far?
I don't know how many times that's happening. I know that they're investigating that right now.
Those numbers come from places like the CDC and Johns Hopkins. Do you think they're just misunderstanding this illness?
Well, I think that they have, initially they misrepresented what was being asked.
And they're the premier health organizations in the country.
Yeah,
why would they want to misrepresent information?
I don't know that it was intentional, but I do know that they told, and it was on their website, I probably took a snapshot, a shot of that, but on their website initially, their guidelines were, if somebody died and you even thought that it might be, you make that a COVID death.
And so the 210,000 people who have died
could be much fewer than that.
Do you think it's off by 10%?
I don't know.
Do you think it's off by 50%?
I honestly can't, but I think it's significant, I would say that.
Okay. How bad would coronavirus have to get in Wisconsin before you would support some kind of state rule that limited businesses, required masks, or put on some other sort of restriction on how we live our lives day to day?
Well, I would say this. This is America, and businesses that are here in the state of Wisconsin, small businesses, and I will direct my thing to the small businesses, because the small businesses, they know that they have to survive, and they will do whatever it takes to be able to do their business safely, because they don't want to lose customers. Because there's
my question is there any circumstance in which you would say, yes, we need a mask, or we need some kind of
a mask mandate?
Yes. Any circumstance?
No, I don't think there is.
It's a number of cases.
With the
increased
exception,
by 10 times.
Okay.
If we had 10 times the number of cases every day, should we have a mask mandate?
Well, I think the first thing we have to do is we have to show that the cases being reported are factual.
Okay, let's say you get numbers that alarm you.
And it's factual.
You see a huge increase.
Okay.
Massive increase of deaths, of cases, of spread. In that case, would you say, yes, we need a mask mandate? Or is it just...
No.
No, why not?
No, I wouldn't.
Why not?
Because here again, you're lumping it with everybody. You're going to have a 3-year-old wearing a mask when they're not affected by it.
Okay.
Are you going to have somebody
5 years old and older?
Are you going to have somebody who is under 20, as an example? This is CDC numbers again. People that are under 20, they have had 0 deaths. And well, I mean,
that's not true.
Well, maybe it's 0.13. So it's less than a third of a percent that have had the disease, but they're not being.
Those people can spread it to older people who.
Well, that has not actually been determined yet.
So you don't think a 20-year-old who goes and sees their grandmother could spread it to her?
Oh, I guess it's possible. I sure wouldn't.
Possible?
Sure,
it's
I wouldn't.
Spread? Okay.
I wouldn't go and visit my grandparents.
Okay. You don't want a mask mandate. You do think people should mask up. Why are you wearing a mask today?
Because it's required in the building, and I am close to people. You and I are chatting, and I respect that in the building they're asking us to do it. You're in the Senate wing. When you're in the Senate wing, we don't have a mandate in the Senate wing because we control the Senate wing. The senators do. We don't have a mask mandate there. However, people can wear it, and if they're comfortable with it, but they don't have to. We let them make their own choice. And I make the choice that I don't want to pick something else up from somebody else either, because we're just talking about it that it is potentially it's not just with the droplets that it can transfer, and they say it's body-to-body contact is what really transfers it. Right. So if you and I were 2 inches from each other, or I was giving my wife a kiss, where there's a potential of fluids being transfer, something like that, there's a potential of spreading it even faster. But if it goes on to a hard surface, something like that, it's like 1/10 of a percent. It's like ridiculous, And so I think we're learning more about the virus, and I think that it always makes sense to err on the side of caution, but that should be my choice. Nobody should be dictating to me when I have to wear a mask. unless they, like as an example, and I use this as an example, we have Menards. And Menards has determined that they want people who shop in their store to wear a mask. So when I go to Menards, I wear a mask because I respect what they're saying and I want to shop there. But if I didn't like the mask thing, I would just say adios and I'd go someplace else. But I'm respecting what they do. I like the store, I like what they're trying to do, and they want to keep their people safe. And there's been so much misinformation that's been spread out there. There's so much fear going out there from the other side of the aisle mainly. They're making it a fear tactic. I would bet you on November 4th, you're going to see all those ads going away and they won't even be talking about it then. We have SARS still, don't we? We have tuberculosis still. We have spinal meningitis still. We have mumps and measles coming back because people didn't do vaccines. And I can tell you, like I said, when I was an officer, I dealt with people I dealt with their body fluids and everything else. And I didn't contract it because I used good hygiene and I didn't overdo what I was supposed to do.